So let's talk how we can use the MLF1 to give a nice revitalization of the skin of the hands. Most of the patients, they come to us asking to make the skin a bit thicker in order to cover the tendons or to cover the veins, to give nicer texture to the elderly hands. Hyaluronic acid is the material we need actually, because recalling the water gives more thickness and of course also is improving the quality of the skin. I like to use the MLF1 on the hands using a cannula, so my entry point is a little space in between the scaphoid, the lunate and the radius, so we are in the radiocarpal joint. Usually I ask the patient to bend the hand in this way. I feel there is a small groove here, I mark the groove and then I proceed with the local anesthesia in this part. Don't forget, use always plain lidocaine whenever you inject on the hands or on the feet, because if you use something with adrenaline, we can compromise the vascularization of the hand. So, as always, we're going to disinfect the whole area. This is very important. It's also very important to do a proper inspection of the area we have to treat, because if the patient has some keratosis, some inflammation of the skin on the palm or on the dorsum, if the patient has arthritis, for example, or Raynaud syndrome, we don't treat the patient, because when we inject the filler, we give an inflammation. If the patient has already chronic inflammation, we can compromise the result, of course, and also the stability of the hand, let's say. So this is my entry point. I mark it again. I disinfect it again. I do a local injection, local anesthesia, checking always I'm not injecting into the vein, so just relax, put it flat. I pinch the skin. I'm doing a small injection. Okay, you will just feel a bit of burn. 1, 2, 3, zip, suction test, and 0.2, 0.1 of lidocaine. There we are. We wait 1 minute in this case, and we proceed with the entry point. Entry point made by 21 gauge needle, the classic green needle we use for the normal injection. As you can see here, there is a vein, so I would be a bit more lateral. Small prick. 1, 2, 3. Pain? No. Okay, I will check again. Perfect. The injection has to be made always under the skin, so we're talking always about under the dermis, so hypodermis. I use cannula of 22 gauge. This is 7 centimeter, but we can use also 10 centimeter. As you can see in this cannula, there is already a dot indicating the exit point of the filler, so we don't need to mark it. Now my technique, because like this could be awkward to do the injection, is asking the patient to put the arm a bit forward. We bend a bit the hand and we go for the injection. Very simply, we do like this. We are always parallel to the surface of the hand and we do retrograde injection. We don't need more than 1.5 ml each hand. We don't want to hit the veins. We want to stay just under the skin. If we feel much resistance, we just go back and we go and we push again. I inject a bit, retrograde injection. I change the direction, I go more medial. Again, tell me if you feel pain. Retrograde injection. I change again my direction. Pain? Always be gentle. Okay, We injected 1.5 ml, always with the disinfectant. Here is very important to be clean. We cover the entry point, we ask the patient to put the hand back, and we massage. Here we don't see an immediate result. The result will be better after, let's say, 5-7 days, because we need the time for the skin to recall, for the hyaluronic acid to recall the water, and to improve the production, increase the production of the new collagen. As you can see, there is nothing left on the hand. And can you show me the other one, please? We put next to each other, but on the same time, we can see that the texture is already better immediately after, and the vein and the tendon are showing less. I injected in the radius and the retrograde way only 1.5 ml all over the hand. This is the result. We keep doing some massage to avoid to show the superficial bump, and that's it. What to expect? The patient for the next 2-3 days will have a bit of redness, a small inflammation. She shouldn't have any bruise, but if you are not careful and you go through the vein, the patient will have bruise, and in that case you stop immediately the injection and you ask the patient to come back after 10 days for the follow-up and to see if she needs more injection. I want to talk about some questions that they ask me, like, can I do the injection from here? Can I do the injection on the notch? Can I do the injection on the side? Okay, let's start from the beginning. You can do the injection from here, but you have to do 1, 2, 3, 4 entry point, while from here you do only 1. Injection on the notch, yes, you can do that. You can do with a small needle, 30 gauge or 27 gauge, a small amount. I don't see a big utility to do the injection here. It's like if you do the injection on the elbows. Can I do the injection on the lateral? Oh, absolutely not, because the arteries are here. So we inject the filler here, we risk to give more pressure. We basically, it's like pinching the finger, and we can really have a vascular problem on the tip of the fingers. Okay, that's it. Just a small tape and we're done.